All right, so we'll begin now. So this lecture is on evaluation. And basically what you're trying to understand in this lecture is to understand the different types of evaluation. So now when we go on real life implications of this lecture, which is a slide you will find in all of my lectures, why is this important for you? How is this going to be important for you when you start working? So as irrespective of any field that you are in, which is clinical, food service, or community public health, a very important factor for any project development, planning, implementation is the evaluation part, which is the last bit of it. Evaluation is very important. Evaluation is generally done quantitatively or qualitatively, and we'll be looking into that very soon. A lot of dietitians who have graduated, say 10 to 15 years beforehand, who are going to be your future employers, very few of them are confident with their evaluation skills, especially because it involves analysis. If you remember your senior student, Yelena, who had come in week 1 to share her experience, she said that the first thing which the dietitians asked her during her placement was, do you know SPSS? Why would it be important for Yelena to know SPSS? Is because they are wanting her to do a quantitative evaluation. And therefore, having these evaluation skills is going to be your X factor in your resume, because not many dietitians are confident with their evaluation skills. So make this your selling point and make this your strong point. Moving further, as you know, this is a formality which I include for every lecture, so you can go through this. Now, yes, what is it? Why is there a need for evaluation? Very importantly, when you have planned a program, you have implemented a program, now you want to see whether it is working or not. Has this been effective for your participants? Has it really shown any results or not? So basically, evaluation gives you results, short-term results and long-term results. And that is why evaluation is important, because you want to see that whatever you have done, whether it has been successful, whether it has created an impact, or whether it has not created any impact and it's been completely useless. All right, so that's why you do evaluation, to find out whether your program has been successful or not. All right. Different ways to do evaluation, as I said, and we'll be going through that very soon. Basically, you doing an evaluation helps you to compare whether your intervention has been successful in comparison to other interventions of similar type. All right, so maybe a colleague of yours has done the same kind of intervention on fruit and vegetable intake among children in Adelaide, and you're doing the same kind of intervention in Sydney or in Canberra. So you want to compare whether your has been successful in comparison to others who are there in the market. You want to see that. So that is external benchmarking, when you compare your thing to a certain reference standard. Internal benchmarking is what you want to see is that whether the time, resources, money, manpower, everything that you spend on your own intervention, whether it has been a success. So that is just your internal benchmark. So whether I have seen an improvement in my participants from baseline till endpoint internally. Then you want to see whether your intervention has been successful in comparison to other interventions which are there in the same space. All right, so that is the need for evaluation, or why you should be doing evaluation. Evaluation is very, very important if you want funding. And as I said, funding doesn't mean research funding. For you to be employable, for you to get promotion in your jobs, the more funding you secure from NGOs, from industry partners, from governmental organizations, the more chances that you will be promoted. All right. So now funders want to see whether you have done an evaluation for whatever you have implemented and how successful has it been from your own internal standpoint, point A to B, and how successful has it been compared to other interventions in the same space. Okay, so don't get scared with this diagram. This is just to show you the different types or levels of evaluation. Another way of diagrammatically representing this same concept is in this manner, which is a bit more simple. We will be going through the different types of evaluation which are of most importance in the area of community and public health nutrition. All right, so I'll just basically start and I'll tell you what are the different levels important for community public health nutrition. So the different levels of evaluation. So whatever was there in the diagram, I have now tried to summarize it in lecture slides. Okay, so it is not different from what was there in the diagram. Basically, I'm explaining the diagram in simple terms. All right, so what are the different levels of evaluation? There are a couple of different levels: formative, process, impact, outcome, economic evaluation. As a dietitian, what do you most predominantly do? Even if it's a very rough, a small scale intervention, the three most important type of evaluations that is done generally in the space in working field is process evaluation, impact evaluation, and outcome evaluation. It's good to do formative evaluation if you can, but if you're say time constrained, resource constrained, the three most important things that are seen by your say funding bodies, your managers, your bosses is whether has she done process evaluation, impact, and outcome. These are the general terminologies which are used even in the placement setting. So get used to these type of terminologies and use these same terminologies when you're talking in your placements, in your internships, and then in your real life positions. Economic evaluation is just an FYI. So I have a couple of slides on economic evaluation at the end in this lecture. They are just an FYI for you. Dietitians don't do economic evaluation. You have economists who do economic evaluation, but you should just have a rough idea of what this means. Okay. So what is formative evaluation? Formative evaluation is basically done before any data collection starts, before any intervention implementation starts. It is done at a planning stage. All right. So basically, for instance, when I am doing my picky eating study, which you guys are well aware of now, I've bombarded you with so many of my picky eating examples. So what is the formative evaluation in my picky eating study? So basically, when I first developed my questionnaire, my picky eating questionnaire, which was based on literature and evidence, I just didn't come up with the questions. So basically, this is important. You don't just make up a questionnaire. You actually look at the literature and you have certain evidences to justify why you have these questions and why you don't have certain questions, things like that. So basically, when I drafted my questionnaire, I went to dietitians, expert dietitians, to ask them whether my questionnaire made sense, to get their feedback, to improve basically the questionnaire. Then I piloted my questionnaire even before the intervention started or anything. All right. So I piloted my questionnaire with 15 mothers and children who were not part of my main study. So these 15 mothers and children were not then included in my big sample size of 300 people who are my actual study. All right. So I piloted this questionnaire to get their opinion, which is, do you understand the questionnaire from a participant point of view? Because these are my important stakeholders. If they interpret the questionnaire correctly, and I got a lot of feedback. I won't go into details of that, but basically what am I trying to say is you do formative evaluation before you implement your intervention, okay? Before it hits the public, which is your public meaning your participants, that is when you do. Formative evaluation is done in the backgrounds. All right, the first thing which you do. We'll be going into much more detail about various types of evaluation within this, but basically this is what roughly formative evaluation is. For instance, when you are advertising your study to invite participants, you want to see how many people have liked your study on Facebook or any other media which you have used, how many expression of interest have come. For example, people calling you and asking you, so can you tell me a bit more about your study? Not necessary that they will participate, not necessary that they are eligible to participate, but basically you're just collecting data on so many people were interested in my study, so many hits it received, view it received, like it received. For example, if of course you will not do that, but those who are in my picky eating, who will be my research students next semester, for instance, I have developed a YouTube video to promote the picky eating study. So I record the number of views on my YouTube video regarding the picky eating study. Now this is formative evaluation. Before I start my intervention, I'm recording all this background data. I think this is clear enough. What is formative evaluation? Now we'll go on to process evaluation. So what is process evaluation? Process evaluation, there are various types of process evaluation. Basically, once you have implemented the intervention, that is when process evaluation happens. I will go into process evaluation in much more detail because it comes in the further slides. But basically, remember, process evaluation happens once you have implemented the intervention. All right. Impact evaluation and outcome evaluation, very, very important. So impact evaluation is short-term evaluation. All right. So, and very important from your assignment point of view. So in assignment 2, when you are implementing the intervention in the classroom, thinking of your classmates as your stakeholders, you're doing a pre-post questionnaire, right? So that is impact evaluation, immediate short-term evaluation. So you're testing your participants' knowledge or awareness about certain things, all right? So that is called impact evaluation, which is immediate short-term. Basically, always remember the thumb rule, the principal rule is in short-term evaluation, the only thing which can change is a person's knowledge, a person's awareness, all right? Very difficult to change anything else in just say 20 minutes or 1 hour, say intervention. For example, when you go on placements, you may be asked to be given, depending upon the stage at where the organization is, and if you are doing intervention implementation, you may be told to give a 45 minutes or 1 hour intervention. All you can do is impact evaluation before and after. Outcome evaluation is long-term evaluation, meaning you're testing the same knowledge, attitude. You can test knowledge, attitude, say immediately after your intervention, then maybe say after 6 weeks, after 3 months, after 1 year, things like that. But in outcome evaluation, which is your long-term evaluation, you can look at much more other variables, such as change in BMI, change in HbA1c, change in lipid profile, all of these kind of things, weight loss, all right? So all these kind of things is what you can do a much more robust, a much more detailed evaluation if you're doing outcome evaluation, which is logical that in this unit, which is a 13 weeks unit, I cannot really make you do an outcome evaluation. Even when you go on your placements, because it's a 6 weeks placement, it is even shorter than your coursework. You are not generally doing outcome evaluation. You may be designing a questionnaire for your supervisors who are dietitians, that these are the kind of questions you can ask them for outcome evaluation, but basically you don't have the opportunity to do outcome evaluation at this stage. You will do this when you are employed and when you are, say, in a project, running a project in a long-term scale. And economic evaluation, as I said, one thing which a dietitian doesn't have to worry about is economic evaluation. This is generally done by an economist, but it is good to know. So when they are speaking the lingo, you're like not completely blank and don't look like dodos. So that's why it's important. All right. Okay, moving further. So process evaluation. As I said, the 3 main type of evaluations, which is generally done in our space, in the space of dietetics, is process, impact, and outcome evaluation, irrespective of your job. Okay, so when I talk about evaluation, guys, it is not just community nutrition jobs. If you are good and if you are confident in what you do, you can do this for your clinical jobs, you can do this for your food service jobs. And these are the kind of things, you know, which really helps you to advocate why you should be promoted, or, you know, how you can add more value to the job and things like that. All right. So process evaluation. So as I said, there are different types of process evaluation. One is exposure and reach. And the example which I have given, guys, WDP means Voluntary Diabetes Program. As I said that when I was working at Western Sydney University as a postdoc, I was employed in 2 roles. Basically, my supervisor, David Simmons, Professor David Simmons, in Western Sydney, he was trying to find 2 people, one who was a researcher, like who's done a PhD and who has good research knowledge, and the other who's a dietitian, who has good dietetic knowledge. So when I went for interview, And he said, and because from the position description I could make out that, and the selection criteria I could make out, oh, hang on, he needs somebody who has didactic skills and research skills. Well, he doesn't need to employ two people. I can actually do both the work. All right, so that is how you sell yourself. So basically, I told him that yes, I can do both of the work because I am a practicing dietitian. I am an advanced APD, and on top of that, I have done my PhD. I know how to do research. I know the logistics of research. Even if you haven't done your PhD, but if you know the research skills and you have evidence to prove it. For example, you have taken the initiative and the efforts to say do impact evaluation, process evaluation as part of your assignment too. These are all of your evidences which you can show to your employers that, see, I have done this. Although I have not done a PhD, doesn't mean I don't know research. So I told him that rather than employing two people, give me a chance and I can do both of these things. So I was employed as a dietitian, research dietitian, basically, which means researcher and a dietitian. And there are many, many such positions, guys, right now, which are looking at this complete package, because the competition has increased a lot in the workspace and all of you are aware of it. More skills you have, better your chances for employment. Okay, now I'll stop with that. So process evaluation, the first type is exposure and reach. So as part of the voluntary diabetes program, basically, I wanted to do a process evaluation in which I wanted to show that what is my outreach. So how many, for example, we had done many things. For example, flyer distribution. We directly handed flyers to the participants. 170 participants, indirectly handed to 3,000 people. How? Via social media, via placing flyers in GP's offices and in shopping centers, etc., etc. So this is how we did. Then we did many things. For example, asking the GP to refer their patients to our intervention. So via referral. Then door-to-door assortment survey. What does this mean? For example, asking them, do they know about the voluntary diabetes program, and asking them screening questions. If they are really eligible, then giving them a flyer of our study. So these are the kind of assortment surveys which you can do once you start like promoting and advocating your project. So this was like an ongoing thing. Why is this not classified as formative evaluation? Is because the intervention had already been implemented, but as the intervention was going on, we were rolling in the participants. So we have, say, 10 participants recruited in this month. Next month, we have 15 participants. So it was an ongoing process. That's why this is classified as process evaluation. Now, the second type of process evaluation, which is generally done, and this is something, it's not compulsory, but this is something which you can do as part of your assignment too, which is when you are actually doing the implementation in class and you're collecting, and you're doing evaluation as well, where you're collecting data pre-post. So basically, the second type of process evaluation is gauging your participants or your stakeholders' satisfaction. Meaning there are two types of satisfaction generally which you can gauge and which is commonly done in the dietetic field. One is service-based satisfaction, meaning were they happy with the venue, were there enough parking spots, did the intervention start timely, was the projector working, all of those logistics kind of thing. So service-based satisfaction. Then comes the content-based satisfaction. Very important, again, as a dietitian to you. Meaning, example, if you gave a intervention or to type 2 diabetic individuals about carbohydrate counting, did they understand basically what is carbohydrate counting? Do they feel confident now to implement carbohydrate counting in their day-to-day life? Did they understand you? Were you speaking too fast or too slow? Did they understand your accent? For example, when I do interventions, I definitely ask my participants, do you understand my accent? Luckily in Australia, you don't have this problem. I think they are pretty much used to Indian accent now. But basically things like that. When you handed them out flyers and materials, was the font size too small, too big? Were they able to read things which were there on your presentation slide, or were your presentation slide like an essay, which was like so difficult for them to read because too many words? Things like that. All right, so these are the kind of things which you want to gain as part of your satisfaction. You have them as questionnaires. In your questionnaire, you have a section on process evaluation. I'll teach you how to do this later on. as part of your questionnaires. But if you want to do it or not, it is up to you. Again, as I said, for you to get more Ds and HDs, the more input you put in, the more support I can give you. All right. Moving further, the other type of process evaluation is delivery. For example, and I'll tell you what is a Gantt chart. Some of you may be knowing already, especially we have classmates with us who are already working in the space as nutrition assistants and things like that. So for example, Gantt chart is where are you meeting your milestones for your intervention planning cycle? For example, in week 1, you were to start recruitment. Have you really started, or are you lagging behind? Then even say during the intervention, was the delivery on time? Or did you spend a lot of time in the first section of your intervention, and for the last section, you were just rushing things? Then the individuals who were delivering the intervention, were they confident enough or not? So these are the kind of things which comes with delivery. All right, so that is also a part of process evaluation. Then comes the context evaluation, which is a type of process evaluation, which is you want to gauge the social, environmental, financial factors that may have influenced or even contaminated your evaluation. That's my papa at the back, so don't mind. All right. Okay, so with the, as I said, with context evaluation, for instance, I'll again give you the example of Wulandali Diabetes Program. So now within the Wulandali Diabetes Program, I was one of the research dietitians. I had one more colleague who was my research dietitian as well. And both of us were delivering interventions to different audiences, the same intervention, but to different participants, because we had a lot of participants. So we had 2 people who were doing the same thing. So the content was the same, but was delivered by 2 different people. The kind of feedback which I got in the interventions which I delivered, for example, was that, for example, the research dietitian A, which is me, they could understand, say, the concepts of carbohydrate counting and things very, they understood it well, is because my teaching style. I use a lot of examples, lot of hands-on things. I break it down. I try to dumb it down. Why? Because that is what you should do as a dietitian. Whereas the other dietitian, who was more of a researcher and less of a dietitian, she used to explain the theoretical things very well, but then how do you really do that in real life was something which was missing. So those kind of things her participants were a bit unhappy about. So this is what, this would then, become a very big reason as to why, for example, in the future, my participants have a lower HbA1c, because they understood what they had to do to lower their HbA1c, and why group B may not have the same results, because they didn't understand in the first place how do you implement this knowledge in real life. So do you see the difference? So these process evaluation is very, very important. Why? Because especially when you have to give reasons to your funders as to why something was successful in your intervention versus not, these are the kind of reasons which may come out. That's why process evaluation is extremely important. Now moving further, the last type of process evaluation is fidelity. So fidelity is, for example, you have a third person, a unbiased person who's not part of your research, and they are checking the fidelity of your intervention. For instance, in the Wulandali Diabetes Program, our interventions were audio video recorded. All right. So when I was delivering the intervention, when my colleague was delivering the intervention, this all was audio video recorded. We had the third person who had a checklist, a criteria, who used to see, is this covered in the intervention? Then how well is it covered? We had actually 2 people who were testing for fidelity, and both of them came with the same conclusion, that is, the dietitian A needs to include more hands-on things, otherwise the intervention will be compromised, because participants may not understand how to actually implement these things in real life. All right, so that's how you check for fidelity. Okay, so, and that is how you don't just assess your actual delivery of your intervention fidelity, for fidelity, but for example, the resources which you have developed. For instance, you develop flyers, you develop recipe booklets, whatever. So you have a third person who is gauging this from a different view to see whether you have met a set list of criteria to say that, yes, this has been checked for fidelity. All right, so that is what fidelity means. All right, so now comes impact and outcome evaluation. Now, very important, remember guys, the things which you are testing in impact evaluation, they can definitely be tested for outcome evaluation in the long run. But there are certain things which you can test in outcome evaluation, which you cannot test in impact evaluation. So now in terms of impact evaluation, which is something which you will be doing in the classroom, because your interventions will be nutrition education based intervention. When I say education based intervention, the main thing which you can really improve is the individual's knowledge and awareness about certain things. Okay, nothing can, you can't really change anything else in 20 minutes. So for example, knowledge. So for instance, they did not know how to do carbohydrate counting. Your participants, for instance, now they know how to do carbohydrate counting. That is change in knowledge. Yes, you can test this immediately after your intervention, and to see whether they have retained this knowledge, you test it after say 6 months, 12 months, things like that. All right. Then change in attitude and self-efficacy. Self-efficacy, yes, you can kind of gauge immediately after your intervention, but it is not a very strong variable to check just after your intervention. For example, yes, your participants will feel more confident now immediately after the intervention because they know the concept of carbohydrate counting. Now they are not as lost as they were previously. So yes, they do feel confident, but true confidence comes once they start implementing this knowledge in their day-to-day life, and then you see whether they really feel confident. Because once they start implementing this in their real life, they will see a change in their HbA1c levels or glucose levels. They will be doing this day-to-day carbohydrate counting. That is when you can gauge true self-confidence. And maybe you may find that just after your intervention, their self-confidence was say 4 out of 10. So they were kind of confident, but not very confident. But maybe after 6 months, they have like 9 out of 10. Why? Because now they have implemented this in real life and they feel more confident because they are actually doing it. So self-efficacy, yes, it is good to gauge after your intervention, but it is very important to gauge it during the long run, which is an outcome evaluation. Attitude. So see, sometimes what may happen is that people are aware of certain things. For example, when we did interventions in the tribal area of Maharashtra, Maharashtra is a state in India. So when I did my 2 years of postdoc in India, what I saw was that the tribal mothers, they were aware that yes, colostrum, which is the first milk which you get right when you start breastfeeding, that is very good. They didn't know why it is good, but they knew that it is good for their children and for their babies and things like that. But because of certain cultural practices, it is considered bad milk, and the cultural habits and taboos asks them to throw that milk away, discard that milk, and then start feeding. So it is not that they don't have the knowledge of something being right. They are aware of it. However, even if they are aware of it, they are not doing it because of certain cultural practices. Now, this can be captured as awareness. This can be captured as attitude which is formed because of cultural perceptions. So then when we told them, when we showed them, for example, pictures of babies who were fed colostrum versus who were not fed colostrum, how there is less risk of children dying due to diarrhea and due to say, communicable diseases, because they are spread, they are fed colostrum, because as you know, colostrum has a lot of immunoglobulins, lot of antibodies, meaning good immunity, and therefore good for the baby. So like, they knew it is good, but because they did not know the details of it, when we said that your baby has a lot of good chances of living longer, a healthy life, becoming smarter, less probability of catching all these contagious diseases, then they were convinced that even if they have these cultural perceptions, they want to start feeding colostrum to their baby, because now they know their awareness has increased, that why something is good. And that is what made a change in their attitude, in their level or the degree of awareness. They always had a knowledge that this is good, but now they have more depth of why something is good. All right, so this is what I mean by attitude or awareness. Yes, you can have an immediate change, and it is very important to test awareness, attitude, long term. All right, now behavior is your health behaviors. For example, you may have given a intervention for children to increase their intake of veggies or to decrease their intake of sugar sweetened beverages. So has their health behavior changed in the long run? All right, so now immediately you have given an intervention of fruit and veggie intake. It's not that you can measure if they have increased their veggie intake just after the intervention. That's ridiculous. You can't do that, right? So that's why health behavior is something which you gauge in the long run, which is, has their vegetable intake improved, has their sugar sweetened beverage intake decreased, or has their water consumption increased? These type of things, health behaviors. All right. So now as I've said, guys, over here I have said impact and outcome evaluation, because these are the things which you can measure short term and long term. But there are certain things which you can only measure long term, which is part of outcome evaluation. For example, health status, like say, if you're doing a intervention with iron deficiency anemic people, then their iron levels. Social support, for example, you have in the voluntary diabetes program, we had trained peer support facilitators. Just to take an example which you can really connect with is, for instance, you have certain mentors, or you had certain mentors in the need assessment mentoring program who were students like you last year. So I have trained them to become mentors this year and to support students, because now they have kind of seen both sides of the coin. They know how challenging it is as a student to be part of a 6 credit point unit and to do this unit, because they have been through the entire cycle. So now when they are mentors, now when I have trained them as mentors, they feel much more confident and they can relate to students better and they can do a better job as a mentor, right? So this is what I'm saying, social support. What kind of social support system have I created to make my program sustainable? So for instance, my need assessment mentoring program, if I had to say, leave this job and go somewhere else, then the need assessment mentoring program would be self-sustainable. Why? Because I can tell the next unit convener of this unit, this is what you can do. For example, train your student. They are so confident in their knowledge base that they then become mentors for this topic next year. So this is how the cycle continues and the program becomes self-sustainable. So again, you can only do this long term. All right, then you have environmental support. For example, again, this is in the long term. For instance, you have encouraged your participants to have less sugary beverages and to drink more water and things like that. But what if gradually there are policies which are designed, and there are policies which are designed. For example, a lot of policies have been implemented in this in Mexico, in even in India, in say where was it? Yeah, Iran, that sugar sweetened beverages should have higher taxes. And evaluation in these places have shown that the sugar intake has actually decreased. And I think we also saw a video of this in one of the previous lectures. So yes, so when you have it at a policy level, what is the environmental support you're getting, which is going to support your intervention? For example, you have done it at a grassroots level to encourage your participants not to have sugary beverages. But now when the government has higher taxes on sugary beverages, it is highly likely that their consumption will decrease automatically, because they don't want to spend so much for just a can of Coke, for instance. All right. So now, guys, as I said, process impact and outcome evaluation, you can do this using quantitative methods, qualitative methods, and something called data triangulation. Basically, when you do quantitative and qualitative together, this is called mixed methods. And you should be well aware of this term. Why? Because it's used a lot in the workspace right now. A lot of people, supervisors prefer you to use mixed methods approach. What is mixed methods? When you do qualitative evaluation, or you have a qualitative component and you have a quantitative component in your study. So now, for instance, what you're going to do in your assignment 2, which is pre-post questionnaire, you are going to do a quantitative evaluation. All right. You may have certain sections. Say if you are aiming for your Ds, HDs, stuff like that, you may have a qualitative evaluation section as well, where you are asking open-ended questions and then you are recording this and then you are say submitting this as part of your manuscript. So that all depends on you, but basically yes, for your papers you can have a mixed methods approach, or for your assignments, or the minimum which you will be having is the quantitative evaluation. All right. So, and how to do quantitative evaluation and a bit of qualitative evaluation. This is something which we will be covering in future weeks. All right. So now data triangulation, or by the time this you will hear this lecture, we would have actually covered it. So now data triangulation. So what is data triangulation? Which is cross verification of the same thing via two or more sources. There are different ways of doing data triangulation. So now with data triangulation, you have three methods, most common methods which are used. One is data source triangulation, which is you look at previously published governmental documents, surveys, interviews, things like that, to see whether it is giving the same kind of outcome which your study has given. All right. So for example, you did a intervention, and you did a qualitative component in it, in which you did focus group with your participants to see whether they understood the survey, whether they feel that this was beneficial, whether after 6 months you did a focus group with them again to see whether they feel more confident now with their carbohydrate counting skills, and whether they have a reduction in HbA1c, things like that. So you try to find literature, which is say scientific literature like journal articles, governmental reports, who have done similar things, like a similar sort of an intervention, which was to say give nutrition education to participants, which would help them reduce their HbA1c levels, things like that. And then you see that whether they had the same kind of outcomes, which is results, compared to yours. So one way of doing data triangulation is comparing your findings to the existing literature. All right. So that is one way of data triangulation. Second is researcher triangulation. So an example of researcher triangulation was, for instance, we had used this for process evaluation, researchers triangulation. As I said, that there were two of us who were delivering the intervention, and we had two unbiased researchers who were checking for fidelity. All right. So fidelity as an evaluation, as a process evaluation, is a type of researcher triangulation. All right. So you have some third person who's checking this. All right. Then you have methods triangulation. So what is methods triangulation? For instance, again, I have done a quantitative questionnaire, and we did this in the Tongan study. So last year, as I said, one of your classmates, Freya, and there was another honor student, Jennifer. They had gone to Tonga. Freya had done the quantitative part of the study, which is questionnaire bit, which was all quantitative, and Jennifer had done focus groups, which was the qualitative bit. And then when we compared the outcomes of Freya's work with Jennifer's work, which is quantitative versus qualitative, we found the same kind of things. That is, for example, the Tongan participants, they did not have knowledge about these things. And in the focus groups, they admitted that they did not have knowledge about these things. Or if in the quantitative questionnaire, they said that yes, there are limited allied health services, in the focus group, they said the same thing. So again, if you see, there are two methods of finding the same results. So basically, that is what is meant by data triangulation, which is you are trying to find if your outcomes are valid or if they make sense with some other kind of a resource or material. That could be the literature, that could be some other researcher, unbiased researcher, as an observer looking at your research, or you can do it within your study itself by using two different methods. So I hope this makes sense. This is what is meant by data triangulation. A lot of fields, for example, I know Nutrition Australia, in their last project, they did data triangulation, and they asked the placement students to do data triangulation. But yes, because they were aware of it, they could do data triangulation. All right. So now, guys, comes economic evaluation. And as I said, this is just an FYI. You don't have to do this. It is an economist who does this, but you should just know the terminologies and what it means. All right. So there are four basic types, which are generally related to the dietetic fields, which are most commonly used. So you have cost minimization analysis. So guys, this is not very popularly used now. It was used previously. What does cost minimization analysis mean? It means you have two or more interventions with the same outcomes, meaning intervention A's main outcome was weight loss by 5 kgs, intervention B, weight loss by 5 kgs. Now you want to see that if both of them had the same outcome, which intervention had less cost, okay, which was more cheap to do. All right. So for instance, why is this not very popularly accepted now as the best approach for economic evaluation is because there are a lot of internal and external factors which can impact and influence an intervention. For instance, you may be doing the same intervention as someone else, but maybe you are doing it on, say, Middle Eastern women. All right. So now you have to translate all of your resources, say, maybe in Arabic, maybe in Persian, things like that. So that has increased your cost of your intervention because you needed a official translator and you had to deliver your intervention in Arabic, for instance. So these kind of things are not taken into consideration. This is just like at the end, this intervention was cheaper, but yeah, you can't, this is not a cookie cutter intervention. You can't just fit the same model everywhere, even though it is cheap. Understand? That's why this is not a very popular approach. Exactly how do you do this in analysis, economic evaluation, mathematically? You don't have to get into all that detail. So one step better is cost-effective analysis, where you are comparing two or more interventions which has the same outcome, but you're using one common factor as a measurement of how successful this intervention is. So for instance, at the end, your main thing over here is how less will it cost the healthcare services. So your intervention is about weight loss, all right? So weight loss is, say, the common variable which you want to compare over here. That is your independent variable. So weight loss of 5 kgs is what you want to compare. And the main thing, the factor which at the end, which you want to see, the main outcome of your intervention is that how less will it cost the healthcare system. All right. So you have intervention B, intervention A. The main internal factor which you are measuring is, you may be measuring, say, dietary factors. You may be measuring mental health factors. You may be measuring, say, weight loss factors. You choose one factor out of many of your independent variables. Say change in diet, change in physical activity, change in cognitive behavior, change in BMI, things like that. So basically at the end, you want to see one factor. Over here, I have taken an example of, say, change in BMI, so which is weight loss. So weight loss of 5 kgs in intervention A would result in, say, a reduction of $1.5 million to the government. Whereas weight loss of 5 kgs in intervention B would result in $2.5 billion to the government. So you may think, oh yeah, this one is better. But again, you're not considering a lot of internal and external factors which may influence this. This is not, again, a very good way of doing it, but basically over here, you're trying to keep only one variable constant, which is, it could be, say, dietary change or weight loss change or physical activity change, and how would it impact your final variable. Over here, the final variable which I've done from an economic point of view is reduction of, say, bills to the government. Okay. So you're just keeping one variable constant. The difference over here, cost minimization analysis, no variable constant, you're just looking at the end result. All right. But over here, you're trying to keep one variable constant. Still, it is not the best way to do a economic analysis or evaluation. So now you have cost utility analysis. Cost utility analysis, I'll just take the screen up. So yeah, cost utility analysis This you may have read in papers, especially WHO document as QALS, which is quality adjusted life years, or disability adjusted life years. Things like this, which you may have come across these terminologies, they are cost utility analysis. All right, so I'll just give you one example, very rough example of how this is done. So a quality adjusted life year analysis, how is this done? Okay, so you may have a question, how do you rate your present health? Present would 0 is very poor and 5 is excellent health. Okay, so at baseline, before you started your intervention, participants rated their health as very poor. These could be diabetic individuals, for example. So they gave 0, 1 rating. All right, so on an average, you had a rating of 1. Then you did an intervention for 3 years to improve their HbA1c level, to improve their quality of life, things like that. Now you ask the same question, they rated their health as 4 out of 5, which is very good. All right. Then you do this calculation, which is this 3 years into bracket, which is 4 minus 1. And then you have health gain of 9 quality adjusted life years. All right. So their quality of life, for example, has improved by 9 years, for instance. Okay. So basically, this is good for variables which you can quantitatively measure, like quality adjusted life years in relationship to the change in HbA1c level, or in relationship to change in say body fat percentage. So when you have a variable like HbA1c, BMI, which you can quantitatively measure, then you can relate it to quality adjusted life years or disability adjusted life years. But when you have variables which are very abstract, such as change in improvement in self-efficacy, how will this improve your disability adjusted life years or quality adjusted life years? That is very, very difficult to measure. These kind of variables, which are very subjective in nature. But variables which are very concrete, for example, you are anemic or you're not anemic. You have low HbA1c levels or healthy HbA1c levels or not. So those have cutoffs. That is why this is different. All right. So those quantitative ones, this is a good method to use. Now, the last method, which you should just be aware as an FYI, is cost benefit analysis, where you have 2 or more interventions with multiple outcomes you are including. All right. So this is the most, say, popular way of doing cost economic evaluation. This is what is generally done by an economist. So now if you see these yellow highlighted things, this internal factors or internal outcomes, these are, for example, in this example, overweight and type 2 diabetes risk. Now, external factors, which is in green, I have highlighted them as external things, okay, which are not, which you can't control as part of your intervention, which is the how much does this reduce, or how much benefit does this give to the healthcare system, which is financial reduction, and disability adjusted life years. Okay, so these are your external factors. So basically, I want you to just get a feel of this, which is when you are reading something like this in research papers, at the background, your thought process should be, yes, they have done a cost benefit analysis. So when you read things like this, a $30,000 weight management intervention cost per year. So maybe your intervention, which you did for 1 year, it cost you $30,000 Australian dollars, all right, which was $14 per person per day. Okay, I should have written per day over here, but this is just a hypothetical example, which means could prevent 2% of the study population from becoming overweight. All right, so you may have done a study on 500 people. Of these 500 people on which you did an intervention of $30,000. All right, so the overall intervention for these 500 people was $30,000, per person $14. And then of these 2% people is where you see the weight loss happening. All right, and a further 20% of your study population, the risk of developing type 2 diabetes. So if you do this, say, weight management intervention, 2% of the population will have a reduced risk of becoming overweight and obese. 20% of the population will have a reduced risk of developing type 2 diabetes. And this in turn will save the government $15,000, all right, per year. So meaning the government, so your tax money, $15,000 less money spent because less people are hospitalized, less people are overweight, less comorbidities, things like that. And this in turn will result into $20,000 per year in disability adjusted life years, meaning this much less money spent on disability adjusted life years, meaning people suffering from chronic health disorders, people suffering from poor quality of life at this point of time. All right. So basically, when you read such kind of statements in research paper as a dietitian, what you need to be aware is when you're reading such kind of statements in a paper, this means a cost benefit analysis is done. All right. So from a dietetic point of view, you don't need to know how to do this analysis, but you should know that economic evaluation is important. You may have to factor for this when you are asking for funding from external stakeholders. That is the only thing which we need to know, that we are factoring for this as part of our intervention. All right. Even if you're not applying for funding, if you're designing an intervention in the future, you need to account for economic evaluation. Somebody else will do it, but you need to account for it. You need to plan for it in your bigger picture. All right, guys. So that was the lecture for economic evaluation.